As patients come to the pod, they are greeted by interpreters and staff ready and willing to assist them in completing their patient intake forms. Once inside, a patient's first stop is at Station 1, form screening. Here, trained volunteers will review a patient's form for completeness and signs for contraindications to the prescribed medication. If medical risks are found, a patient is referred to Station A, clinical interviews, for further review. If the presiding physician or nurse finds that a given patient presents contraindications to taking the prescribed medication, then that patient is transferred to the nearest hospital. If a given patient presents no medical risk to taking prescribed medication, then that patient is then referred to Station 2, medication dispensing and forms collection, to receive their medication. In normal cases, patients with no medical risk or contraindications to taking the disease-preventing medication first stop at Station 1, then proceed to Station 2, where they receive medication for themselves and or their families. Now that you are familiar with the basic function of a pod, let's examine cases involving patients with distress and other complex concerns. High-stress situations may be unavoidable, but with proper handling, they can be mitigated. Should a patient become disorderly, pod staff will inform the security staff of the aggressor. Security personnel will then deter and, if necessary, detain person exhibiting disorderly behavior. Mental health personnel are also available for patients needing counseling.
Okay, and you don't have any symptoms?
No.
Okay, go ahead and
You are pregnant and you have epilepsy,
Yes.
correct? Okay, what I'm going to need you to do
Mark,
is I'm going to
no,
need you to
every
wait on
other
this
one.
line over here
Okay.
and have a consult, okay?
Okay.
Before we can give you the
I'm
medication.
gonna wait for my brother though, okay?
he's gonna go ahead and go straight back this way.
Go where?
Straight back to just speak to the pharmacist to get your medication.
I'm not leaving my sister.
Okay, well, she's gonna go over there just to speak to the pharmacist because she has other symptoms and she's pregnant. So you just go ahead and go speak to the patient.
If she going over there, I'm going over there with her.
You guys can meet up later. She just has to go over there just to be comfortable.
We're not going to meet up later because I'm not leaving her.
Do we need to get security or?
You can get whoever you're going to get, but I'm not leaving
Don't
my
worry about it.
sister.
No, I'm gonna be okay.
I'm not going to leave you, no.
I'm gonna be cool. I'll meet you right over there, okay? I'll be all right. I'll be cool.
sure?
Yeah, I'm cool. I'm cool.
All right.
All right.
Hi, good morning. Can I help you?
Yes, I am pregnant and I have epilepsy.
Okay, you are pregnant. All right.
How far along is your pregnancy?
6 months.
Thank you very much.
Thank you.
We're going to count them up real quick.
There's no other alternative? No other...
There are other medications that can be used. However, we don't have them at this site. And if you wish, I can write you a prescription for erythromycin, which would be safe in pregnancy. My preference would be not to wait, since the importance of treatment is time dependent. The faster we can treat you, the less likely it is that you would come down with an infection.
How about we just get the prescription and leave?
We'll go. Let's do that.
You know what I mean?
Let's get it and
I'm
go.
not going to put my little nephew in there.
Let's go. Let's get the prescription and leave,
Okay.
please.
All right. So I'll just. I think that's a reasonable choice. I don't think that you're making.
I'm really tired and I'm not
Sure,
feeling well.
I
I need
understand.
to go sit
Okay.
down.
So there are 24-hour pharmacies available. You can get it filled right away. As a matter of fact, I have a runner, and I'm going to call ahead, and I'll call in the prescription so that as soon as you arrive, it'll be ready for you.
All right.
Actually, we need to have your name.
Okay.
Shoes off.
Thank you.
By the end of the day, the pod is a success. Patients receive disease-preventing medication for themselves and their families. Once the pod doors close, pod staff are debriefed about the day's events during a process called a hot wash.
I'm going to go ahead and start the hot wash, and we'll discuss what went well and what can be improved for today. Thank you.
County Health. So you had the unique situation here, which we've never experienced in a pod before, where all three of us had to work together, and I think we did very well, actually. And Simon mentioned the interoperability with the radios. That was one aspect of it, but also when three agencies get together like this and try to throw something together, it's very important that we interact well with this as well. So that did happen today.
How many of you have done a pod exercise before? Okay, so look around the room. 4 or 5 people. So I want to tell you, we've been doing this now for about 3 years. You guys did a great job. And on every one of these, we learn something new, and we get better at what we're doing. So again, I know there seems to be a lot of negative stuff being said, that we didn't do this, we didn't do that. No matter how many times we do this, it's going to be that way. And look at all the different people that are working together for the first time. So that makes a big difference also.